But this is all about lifestyle approaches, lifestyle medicine approaches to common sleep conditions. So without further ado, let's get started. And I'm usually talking in front of hospital audiences and for CME, so I have disclosure sides in here, but there's nothing in conflict that I'll be discussing today. I work with a couple organizations. There's an online sleep coaching program I work with. I create a curriculum to help with the American College of Lifestyle Medicine. They've also done some consulting work for GAP through their Athleta Well program. Not doing any research at the moment. Great. So our objectives for today, and I have, I think, over 120 slides, but I talk fast, so we'll get them through here pretty fast. We'll talk about what is lifestyle medicine, how do we define it, understand some of the different domains of lifestyle medicine. So there's 6 domains, and then discuss how we really apply the principles of lifestyle medicine to improve common sleep conditions. And then I was going to leave people with practical advice that you can talk to patients, your family, and even for yourself, how to improve your sleep quality. Maybe a little bit of a side is, I practice integrative medicine, which actually, I like to describe integrative medicine as all the things you don't learn in med school that can help someone heal. So that includes things like energy medicine, Ayurvedic medicine, Chinese medicine. Lifestyle medicine is part of that, but it's really focused on a couple things, which I'll go to the next slide. So this is taken from the American College of Lifestyle Medicine, and really what it is, it's a medical specialty. They have their own board for it now, where you learn about therapeutic lifestyle intervention as a primary modality. So a lot of what we do in medicine is, talk to a patient, do some blood work, maybe some imaging, find out what the diagnosis is, match it with a medication or a surgery. And so lifestyle medicine is fantastic. Why? Because you can change someone's chronic disease state, their chronic disease conditions. Things like energy medicine, Ayurvedic medicine, Chinese medicine. Lifestyle medicine is part of that, but it's really focused on a couple things, which I'll go on the next slide. So this is taken from the American College of Lifestyle Medicine. And really what it is, it's a medical specialty. They have their own board for it now, where you learn about therapeutic lifestyle intervention as a primary modality. So a lot of what we do in medicine is, talk to a patient, do some blood work, maybe some imaging, find out what the diagnosis is, match it with a medication or a surgery. And so lifestyle medicine is fantastic. Why? Because you can change someone's chronic disease state, their chronic disease conditions based on changing their lifestyle. Not the easiest thing to do because in our culture, I'm sure everyone knows, they want the quick fix. They want the pill, and they don't want to go through all of the behavior change modifications. But if we take a look at how expensive, our healthcare system is, we're really doing each other a disservice by just, treating the acute issues, right? Doing the surgery. Our hospitals are getting bigger and bigger. But what about our primary care clinics? What about our wellness centers? Yeah, something to think about. So defining lifestyle medicine, again, this is taken from the American College of Lifestyle Medicine's website. And these are the 6 domains. So starting here, healthy eating. So, which I love that Dr. An is all about healthy eating. Increased physical activity, you gotta move your body. There's so many reports now that sitting is the new smoking, right? How long do we sit? I was talking to a exercise specialist, body mechanics lady, and she says there's a new category. It's called the active couch potato. And so, right, you're someone who's sitting at a desk behind a screen, you go to the gym, maybe 30 minutes, an hour, and then you go back to sitting in your car, sitting on your couch. And I think we feel like we're doing good to our body, but our bodies weren't necessarily built to have just little bursts of activity. We're sort of meant to be moving constantly all day long. So yeah, it's really interesting. Sleep well, which is I will definitely talk about because I love talking about sleep. And I know you had a really long day, so if you do end up falling asleep or taking a nap, that is completely fine by me. Be present, avoid risky substances, form and maintain relationships. Diving deep to someone's emotional, psychosocial, spiritual state, because that's just I like to talk about those other things. The simplest way to drastically improve your life. So I don't know if any folks read the New York Times. This is from an article there. It's to get more sleep. So Tim Herrera wrote this back in 2018. He says, imagine this. Someone walks up to you, pitches you on a brand new magical pill. This skill can measurably improve your memory, overall cognitive performance, ability to learn new information, receptivity to facial cues, mood, ability to handle problems, your metabolism, your sort of heart disease, and your immune system, right? One thing can do all of that, and yeah, I know it's already seen. So how important is this, right? Drinking water. You know, how long can you go without drinking water? How about going outside, breathing fresh air and getting sunshine, right? Pretty important to be able to have good quality oxygen going in and out of your lungs. How about this, right? You know, eating healthy food. I'd say pretty darn important, right? And how about sleep? I'm sure you may have heard, right? Sleep is for the weak. I'll sleep when I'm dead. I'll sleep when I'm retired. You know, we have a hustle culture here. I mean, even, you know, probably going to dental school, going through medical school, I did not know anything about sleep. I think now they're training the trainees about it, which is really important. You know, they have the 80-hour work week cap, which I know, you know, some surgeons are told in their training to fudge that. Otherwise, right, they're not going to be able to pass or be accredited. But, you know, you really start changing yourself because sleep is so important for many aspects of your life. And we'll go into why that is here. So the science of sleep, a little complex. I was a neuroscience major, so I like talking about this, but the real point of this slide is that, you know, there's multiple regions of the brain, right? The VLPO, the TMN, the raphe, you know, part of the pons, the thalamus. And when people come to me and they're asking me, okay, Dr. Cacho, give me the pill, the best pill. You know, I've tried this, this, and that. And I've tried cannabis, and I've tried such and such and such. And I'm like, you know what? There's no magic pill. It's not one single switch, right? You know, I talk a lot about, you know, I love how Dr. Balfour is talking about the autonomic nervous system. That plays a really significant role because what sleep is when your brain waves slow down, right? And there's not one specific area where you can just like turn that switch. Not yet. I mean, I think someone really smart is going to figure this out. You know, they're looking at things like, you know, deep brain stimulation, but not quite there yet. But I want to offer people is that I can teach them how to sleep, even without needing medications, or with medications if they are interested. But I have been able to get people who've been on medications for 20, 30 plus years off of it. Yeah, and one of them is just really talking about your thoughts about sleep. What's your relationship with sleep? You know, sometimes people come to me and they're like, Dr. Kasha, I'm a bad sleeper. I've been a bad sleeper since I was a kid. And I'm like, whoa, let's step back. Sleep is not a morality thing, right? Sleep is like drinking water and going outside and moving your body. You're not a bad sleeper. I mean, you may have some habits that aren't helpful, but, you know, sort of taking that pressure off of them where, you know, it's a skill that you need to learn. And that, you know, maybe there's things that happen in your life that sort of threw you off kilter. But by coming here today, we can get you back on track. And I'm here to help support you on that journey. The stages, right? So there's all these different neurotransmitters. And basically what sleep is there's neurotransmitters that help you stay awake. And then there's neurotransmitters that help you go to sleep. So the wake neurons, the wake neurons, neurons and neurotransmitters go off, and then sleep neurotransmitters go turn on. And the biggest ones are GABA, and acetylcholine and adenosine actually, which isn't here. Okay, so the sleep stages. There are 4 sleep stages. There used to be 5. There used to be 1, 2, 3, 4, and then REM, but we took out 4. And so stage 1, sleep. I like to call this the stage of sleep if you're sitting on your couch and you're on your phone and then it falls on your head. Because what happens, right? You get drowsy, right? Your breathing slows, your muscles relax, and you can't hold it anymore. Some people who actually are in stage 1 of sleep, if they're, you know, insomnia, or if they're just, you know, hyper, they may not actually perceive that they're asleep. And actually that's a type of insomnia, what we call paradoxical insomnia, where you have a sleep-wake misperception, which may go away with, you know, a lot of people are trackers now, but it's just sort of something to think about, right? You may be getting more sleep than you think you are because there's lighter stages of sleep. Stage 2 is a little bit deeper, but it's still considered light sleep. Sometimes people with insomnia perceive this stage as being awake. Stage 3 is the deep sleep. This is the sleep that we really, really want, that we need. It's the restorative sleep. If you wake up from this stage of sleep, maybe there's a loud noise, or maybe you have an apnea event, you know, you can feel really groggy because your brain waves are slowing down, are pretty slow. And then the rapid eye movement. This is often where we have our most vivid dreams. We actually know that we can dream throughout the other stages of sleep. It's an active form of sleep, right? our body is paralyzed so we don't act out our dreams. I don't know if this happened to anyone. Sleep paralysis is a big concern until you know what's actually happening. If you wake up and your body's just paralyzed and you can't move, you're typically waking up out of REM. Your brain is waking up before your body's waking up. It typically only lasts a couple seconds. One of the biggest reasons why people have sleep paralysis is because they're sleep deprived. Yeah, so getting enough sleep is really important. And this is just what it looks like if you went to the lab, right? So if I put the EEG leads on your head, what we're looking for is how fast or how slow the brain waves are firing. So alpha waves is for awake, and then the theta waves, which are 4 to 7 hertz, represent sleep. Stage 1, stage 2, stage 3. Stage 3, deep sleep. I like to call this like the undulating waves of the ocean. You see how the amplitude is really high and the width is wide as well. Slow wave sleep, delta wave sleep. This stage of sleep is so important. And I'll talk about why a little bit later. And then REM sleep. It's also really important. So audience participation question. How does our sleep change as we grow older? True or false, we need less sleep? True, false? False. Oh, you guys are smart. You already saw this. How about this? We get less sleep.
True.
Yeah, that's right. Yeah, our sleep need is still, I don't think I have a picture here, but 7 to 9 hours is what's recommended for 18 years and up by the National Sleep Foundation, the American Academy of Sleep Medicine. Sleep architecture for healthy adults. So, sleep tracking is such a big thing right now. There's a Whoop, there's an Oura Ring, there's Fitbit, there's iWatch now that's come to play. And I always question, right? And I've taken a look at some of the articles. Some of the data is pretty helpful. I think 80%, even up to 90%. But if you move around a lot, it may not be as helpful, right? Because, is the data based on actigraphy, which is an accelerometer, right? So if you're moving around, typically you can move between stages 1, 2, 3, and then REM. I've had patients who have come to me and, their iWatch or their Fitbit says, "Oh, doc, it says I get 20% of the night, my sleep is restless." I'm like, "Well, how do you feel in the morning?" "Oh, I feel fine." Like, okay, then don't let, such and such company sort of dictate how you feel, right? Your subjective experience of how you feel in the morning is also really important. Most of the sleep we do get is actually light sleep, right? Stage 2 sleep. Stage 3 is about, 13 to 18. But this is what happens just with aging, healthy aging, right? Your stage 3 sleep declines by 2% per decade, right? Even now, young age, middle age, and then plateaus as we get older. And this is for healthy people, right? Not including if we drink alcohol, right? If we have a lot of caffeine, if we have a lot of stress, if we have untreated sleep apnea, right? If you brux at night, right? That can potentially affect the quality of sleep that we have, our sleep architecture. And then REM is about 20 to 25% of our total sleep. Yeah. So what does sleep even do, right? I'm old enough where I still remember file cabinets, right? So filing cabinets, I think in a couple of years, I'll have to not even have this kind of slide. But yeah, sleep is when memories from the day get put from short term into long term. It's really important for our appetite and our metabolism. They've done studies in college students where they've slept deprived them, healthy college students. And guess what? They tend to eat more of the junk food or the simple carbohydrates, right? Because it's quick fuel. Your body wants fuel, but really what it needs is sleep, right? Your heart, not getting enough sleep for cardiovascular protection, at least 6 hours, right? Your heart doesn't want to be pumping and pumping and pumping 24 hours a day, so on for so long. Not sleeping enough is associated with high blood pressure, irregular heartbeat, heart failure, dying sooner. Colds. There's really interesting research through University of Pittsburgh where they took healthy adults again and they took a look at their sleep. So they actually gave them the common cold. I think it was maybe influenza or it was actually a rhinovirus. They actually gave them the rhinovirus. And those who slept at least more than 7 hours were less likely to get sick as opposed to those who slept 6 hours or less. Those who slept 6 hours or less were 4 times more likely to get sick by actually being exposed to rhinovirus, right? So,
Question.
Yeah.
Do you think that would be true for COVID as well?
Yeah. Yeah, definitely. I don't think we've done, I should have put in that some data. I think there is some data that talks about that. But the biggest thing is sleep is anti-inflammatory, right? When you're not getting enough sleep, your hormones of inflammation just don't work as well, right? Or anti-inflammation. So we know this from rheumatologic studies. So 6 to 8 of the similar genes from the immune system and the sleep system are shared. And so, things like rheumatoid arthritis, right? Lupus, fibromyalgia. An insult to your sleep may actually be a trigger to develop some of these conditions, which is pretty striking, right? And it's not always talked about. Yeah, and it's free and it's available to all of us if we choose to accept that. And then the garbage collector. And I think Dr. Balfour mentioned this, the glymphatic system, right? What happens throughout the day, toxins build up, right? And we have this wonderful clearing system that happens at night. And it happens through what stage? Our deep sleep, right? That stage 3 sleep, right? So if you're shortchanging yourself from getting good quality sleep for whatever reason, then this glymphatic system isn't going to be active. And I think that's potentially, I think we're going to have more data around this. Big reason why we have problems with Alzheimer's, right? And dementia. Alrighty, so according to the CDC, how many people in the US are affected by chronic sleep disorders? Maybe I should ask, how many people live in the US? I think it was 329 million. Yeah, so A, B, C, or D? Who says A? Nobody? Okay. B, 35 million? 1, 2, that's it? Okay. How about 70 million? Oh, more, like 5. And then 95 million. 1, okay. So yeah, you're smart. We're good test takers. So 70 million. That's about 21% of the US population. You guess how many sleep doctors there are? I don't think we have data, but last time I calculated, it was about 1%, 2%. Yeah, not a lot. So you guys are on the forefront, right? You're seeing people in your chairs, snoring, breathing. You're seeing what their airway looks like. And forgive me, my dental pictures are very rudimentary. I basically tell patients at night when you sleep, your muscles relax, the tongue falls back, then you can't breathe. And that leads to all these issues. So the common medical sleep disorders that I'll go over today: obstructive sleep apnea, insomnia, restless leg. I wonder if you dentists see a lot of restless leg too, right? Depending on how long they're in their chair. Periodic limb movement disorder, and then narcolepsy. So, right, obstructive sleep apnea, I think this is probably went over this multiple times already. Yeah, but I have a PowerPoint that I share with my patients when I do our telehealth visits, and I'm always showing this to them, even if they've had sleep apnea before, because you'd be surprised how little information is available. I don't think I included it here, but primary care physicians, about a third of them talk about sleep apnea with their patients. A third. And it's such a common condition. Yeah, so snoring, OSA, and then all the signs and symptoms, right? So stopping breathing, snoring, choking, gasping, having a hard time maintaining sleep. So sleep maintenance insomnia. Sleep apnea typically doesn't keep people from falling asleep unless you're worried that you're going to have an apneic event, and I've seen that. Sometimes people dream that they're being suffocated, that they're drowning, and that's potentially because they have sleep apnea and then they're afraid to go to sleep. Sleepiness during the day, right? Because your brain's constantly waking up with headache, memory impairment, right? When you're not going into those deeper stages of sleep, that glymphatic system isn't turned on, poor concentration, urinating at night, and mood disturbance. That's probably the short list. I really want to talk about is this, gender bias in sleep medicine. So I read a recent article that talked about an overweight, obese man will go to his doctor and he'll get a sleep study. A woman, overweight, obese, will go to a doctor and say, I'm tired and fatigued. And guess what? She'll get sent to a therapist, maybe put on an SSRI or say, I think it's your thyroid, right? You don't have to snore to have sleep apnea, right? 20 to 30% maybe. As we get older, right? As women go through menopause, that should be on our sort of criteria. The rates of sleep apnea double to even triple. Yeah. Sometimes women are just fatigued, have a hard time maintaining sleep, morning headache, and mood disturbances. And that's all they know. Yeah. So I have a very low threshold for getting a sleep study. Restless leg syndrome. The creepy crawly, electric, crazy legs, ants, crawling pain associated with pregnancy, low iron, kidney disease, sitting for too long. The biggest question is what happens when you're on the plane or in a movie theater? Do you need to be on the aisle? Do you need to get up and walk around? It occurs before bedtime and it can keep someone from falling asleep. So this can be a reason why someone has sleep initiation insomnia. 80% of people who have restless leg syndrome can have the nighttime symptoms. So this is called periodic limb movement disorder, PLMD. It's the leg movements that happen when you're asleep. Repetitive kick, 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 kick. Associated with RLS, associated with ADHD, associated with allergy medications, SSRIs, which are antidepressant medications, also caused by low iron. And diagnosed typically by an in-lab sleep study, because with that you can put the EMG sensors on their legs and see how often they kick. Treated with iron supplements or medications. Insomnia, so I really like treating insomnia, I think because I like a challenge. A lot of primary care doctors, on average, I think you have 7 to 8 minutes with someone, maybe 5 minutes face to face, and they have all their other criteria, right? Sleep is almost like the stepchild, I think, in medicine, right? We're focused on mammograms, colonoscopies, your blood pressure, which, are really important. But guess what? If you don't get good sleep, you're probably at risk for those sort of things too. So I think it should be addressed a lot more. Insomnia is defined as difficulty falling asleep, also difficulty maintaining sleep, and it's associated with daytime consequences, right? Headaches, poor performance at work, calling in. And if it lasts longer than 3 months, it's considered chronic. Hypersomnia, I saw someone recently, and in the chief complaint, it said hyperinsomnia. And I was like, did she mean hyperinsomnia? But no, she had really, really bad insomnia, and so she put hyperinsomnia. And I was like, oh, that's cute. Yeah. So what is hypersomnia? Basically opposite. You're tired all the time. The number one reason why is because you're not sleeping enough. You're depriving yourself of sleep. It can be due to obstructive sleep apnea, even if obstructive sleep apnea is treated. Up to 20 to 30% of people can still have residual hypersomnia. Why is that? Well, the way I like to describe it is, imagine there's this part of your brain, like this electrical device. And when you have sleep apnea, the cord that goes into the outlet gets a little bit loose and maybe it falls out. Once you start treating the sleep apnea through, weight loss, through surgery, through oral appliance, through, the things you learned about here, or CPAP, now we're putting the plug back in. But guess what? All those years, all those nights where you're hypoxic, where your cortisol levels are high, where your adrenaline is going, guess what? There are some short circuits. And so it may not be completely reversible. Yeah. And then there's medications that can help treat with that. So we basically put people on medical methamphetamines to make them feel better. But, sometimes you need it, right? If you're in a job where you're, a pilot or, a bus driver, right? You want to make sure that they have enough energy because they could be putting people's lives at risk. Narcolepsy is a central disease of hypersomnia. It occurs in about 1 in 2,000 people, probably very, very undiagnosed. Idiopathic hypersomnia is sort of similar to narcolepsy, but it just depends on what the sleep study shows. I'm going to talk a little bit more about narcolepsy here. So remember those stages of sleep, 1, 2, 3, 4, 1, 2, 3, and then REM. 1, 2, 3, REM, 1, 2, 3, REM, 1, 2, 3, REM. For someone who has narcolepsy, typically it could be a genetic issue or a autoimmune condition. So after H1N1, 2009, there actually was a huge uptick in narcolepsy cases in China. And also there's some smaller studies in the Netherlands when they created a vaccine for that, where, compared to controls, there was a higher level of narcolepsy. Why is that? When you have an autoimmune reaction that affects the hormone called orexin levels go down and you're really, really sleepy regardless of how much sleep you get. And so you're not going through those normal stages, 1, 2, 3 REM, 1, 2, 3 REM. You're awake, you're in REM, you're in non-REM, and you're awake. So you're awake and you're asleep at the same time. And it's pretty awful, right? It's hard for people to study, hold a job. Sometimes, you're seeing your psychiatrist because they think you're depressed. You just have no energy. How do we treat it? Stimulant medications, really strong methamphetamines. There's a newer drug that works on histamine. So instead of blocking histamine, right, that makes you sleepy, we allow more release of the histamine that can actually make you feel awake. And then sodium oxybate, right? Sodium oxybate, also known in the past as GHB, the date rape drug. Some really smart people reformulated it to help with narcolepsy. Doesn't last very long, about 2 hours. You wake up and take the second dose. But people with narcolepsy feel so much better. It's super regulated. There's only one pharmacy in the whole US that provides it, but it's a really good treatment for narcolepsy. Yeah, so if you have, people in their teens, 20s, and 30s that are really tired and they're sleeping 8 to 10 hours, think about narcolepsy. And they need an in-lab sleep study to diagnose that. Questions about the medical side before we get into the fun lifestyle part? Yes, Dr. Yu.
Can you talk about how our sleep architecture changes as we age? Do you find that we get more sleep sooner in the night? Typically, I've seen that in patients, but
so the question is, can you talk about how our sleep architecture changes as we age? I've seen some older people have more REM earlier.
Right, where it's usually reserved, or it's
yeah, so you actually,
early morning, right?
you do, so I should have explained it better. You go through the stages of sleep, 1, 2, 3 in REM, every 90 to 110 minutes. So you can have REM periods in the first half of the night. They're typically longer in the second half of the night. I think, I'm so biased because I do sleep medicine. I'm like, well, if they're having a lot of REM in the first half of the night, it could be that they're sleep deprived. Because we need a minimum amount of sort of REM. We can have a REM debt. So if you have, that's what the best way to describe this. I used to work nights as a hospitalist. And then when I would come home and take a nap, I would instantly go into REM because I wouldn't sleep much during the night, maybe 1 or 2 hours. I would start dreaming immediately because your body craves that REM. So if they're going into REM, they potentially, and it's curious how they know. Because are they using a tracker? Is that really telling them they have REM? The accuracy of that. Because you can also dream during the non-REM periods too. Yeah. So one of the reasons maybe to think or realize you're going to REM during the first half of the night is if you were sleep deprived for a while, now you're getting more sleep, your body's probably making up for some lost REM. Yeah. I don't know if that answers your question.
So it's pretty stable, the sleep architecture usually doesn't change as we age. It should be fairly stable.
Well, less stage 3 and less REM. But it's normal to have REM periods during the first half of the night. They're just longer during the second half of the night.
Okay.
Yeah. Good question. Lifestyle medicine approaches. So, poll the audience. Do you discuss lifestyle recommendations with your patients? Dr. An, yes. I know dentists ask a lot about smoking, I'm sure, right? I'm thinking, how many dentists have asked me about smoking? I don't know. But I know that, at least in medical school and dental school, I'm thinking about. If yes, what are your recommendations, if anyone wants to say?
So,
yes.
For example, if I'm doing an extraction,
Okay.
and if I know it's a smoker,
Mm-hmm.
I just try to scare the hell out of them. You're going to get a dry socket, which is going to be much, much more painful than the infection you had.
Wow.
And you might want to just consider going full turkey.
Wow. That's interesting. Yeah, I guess that makes sense. Cigarette smoke could affect the microvasculature. Anyone else? Tell people to lose weight or exercise or yeah. Alrighty. Eat more vegetables. Good.
Less sweets.
I'm sorry?
Less sugar.
Oh yeah, less sugar. Light. So yeah, let's talk about light. And we'll start off with a case study. Mr. M, he's a retired engineer, he's 68 years old, has a hard time falling asleep. His wife goes to bed at 10 p.m. and he doesn't go to sleep until 2 to 3 a.m., which, guess what, doesn't bother him, but it bothers his wife. And that's why he's in my office, because, there's got to be something wrong with him. On Wednesday, though, it does bother him because it's bowling day, and he has to get up pretty early because, he hangs out with his friends at 6:30. They go to the local diner in Hawaii, right? Have some loco moco, and then they go to the alley. So this is delayed sleep phase syndrome. It's a circadian rhythm issue. That's actually pretty common, more common in adolescence, post-puberty, but, it can still happen as we get older. Probably 10 to 15% of the population are delayed, and all that is, it's a fancy word for being a night owl. So what do? Well, I show him this. This is actually one of my favorite slides to talk about, the sleep-wake cycle. So if anything you remember about my lecture today is there's two biological processes that control our sleep. The first is our homeostatic regulation of sleep, or our sleep drive, right? Oh, perfect, there's a glass here. So for people who are okay, meaning a lot of the patients who see me have disrupted sleep. So I say, okay, maybe 10 years ago, or when you're a kid and you slept well, let's say you slept 9-10 hours, you're not sleepy, right? The minute you wake up, your glass is empty. And that's your sleep drive, right? It starts off with a really low arrow. As the day goes on, you're building this pressure. The cup starts to fill and fill and fill and fill. And it gets to a certain point where you're so tired, typically for most people, 9-10, you go to sleep. Guess what happens if you take a nap? You take a nap, you relieve that pressure. It delays your bedtime because you have to build up more pressure. What is this pressure? Process sleep. It's also adenosine. So what happens when we move our bodies? Get tired, right? Yeah. And what happens when we drink caffeine? That blocks adenosine, right? And then this is my favorite thing to talk about too, and you guys all will know it now. What happens if I wake up 4 or 5 hours later? 5 hours is about the minimum core sleep time. You look at how much the pressure has been relieved. It's like charging your phone battery, right? It's partially charged, right? You can still text, you can go on Netflix, watch a show. Maybe not as good if it was 100%, but if you wake up and go to the bathroom, have an apneic event, the dog barks, something happens, you're not as sleepy, right? Harder to go back to sleep because of this, your homeostatic regulation. Yeah, you're partially charged. Some people know this and like, oh, okay, that makes sense. But some people just hate it. And it's real interesting because I think our culture plays a role. I think we're trained probably by our parents and by the media. If it's dark, you probably should be asleep unless you're working, right? Got to stay in your room for 8 hours and wake up when the light's up. People who wake up in the early middle of the morning, they get very upset. My friend, she's an Ayurvedic medicine doctor, psychiatrist, and sleep doctor. In India, guess what they tell their patients if this happens? That quiet hour, that 3 to 4 a.m. is their yoga nidra time, where they start meditating. It's the quiet time of the night. Yeah, and so they can, recenter, get in touch with their spiritual side. It's very interesting, right? Yeah, but that's a big thing, we're just not as sleepy. And I think that's why we have two systems, right? So we have, the other system is our circadian rhythm. A lot of people talk about circadian rhythms in terms of melatonin. I need melatonin. What's the best melatonin? Melatonin is a whole lecture in and of itself. Long story short, in 2017, there was a big research article and they looked at 31 brands of melatonin. What researchers found was, I think, -30 to up to 420% was actually in the capsule from what the label said, meaning some didn't even have melatonin and some had way more. And even what's scarier is some had serotonin in it. And so if you're someone who can't sleep, you take melatonin, you're also depressed and you're on an antidepressant and you're taking more serotonin, guess what? That's a setup for serotonin syndrome, which it can be an ICU level condition, right? So be careful of melatonin, right? Even in kids. I think the CDC put out recently that, during the pandemic, their parents given babies melatonin and they ended up in the hospital and some of the kids died. Yeah. I mean, for the most part, it's okay to take. My always question is, do you need it and why are you taking it? Yeah. So what is melatonin? It's a natural hormone of darkness, right? Some people call it the hormone of sleep. It gets released when it's dark out, right? It starts to peak when our sleep drive starts to flatten. So we think of melatonin as a person that starts the race. It helps sort of regulate our sleep stages. It's important for anti-cancer and anti-inflammatory, right? I think with the pandemic, people were using melatonin as, okay, maybe that can help prevent COVID. I don't know if the research really panned out. Research does show if you've had breast cancer and you take melatonin, you're less likely to have a second incidence of breast cancer, right? Nurses who work at night typically sleep less and they're exposed to a lot of sort of artificial light. That decreases the amount of melatonin that's released. Higher incidence of breast cancer. Yeah, it's really interesting data. For most of us, what happens is we're exposed to a lot of screens, and so that delays our release of melatonin. So going back to Mr. M. So after a visit, we talked about light, melatonin, circadian rhythms, and really the cure for night owls, if you want to shift your clock back, is to get more light in the morning. Light in the morning tells your brain, A, it's time to be awake, alert, but also tells your brain, okay, the next day I can sleep a little bit earlier. And actually, after 2 weeks, you're cured. And you don't need sleeping pills. I think it's funny because some people are like, well, I've tried Ambien, I've tried Lunesta, and it doesn't work. I'm like, yeah, because where in the circadian rhythm is Ambien? Where is Lunesta, right? It's light, darkness, and melatonin. Pretty simple. Okay, so he just started walking in the morning, 30 to 45 minutes. Within 2 weeks, he was able to fall asleep at midnight, which was okay for him. And his wife was like, okay, midnight's okay. And especially on Wednesday, because then he can hang out with his buddies at the local bowling alley. So that's light. Anyone know what city this is? Yeah. So what happens when you live in a city? The dark side of nocturnal light pollution, outdoor light at night increases risk of coronary artery disease. Whoa. So more light. This was like 10% to 11% from odds ratio, right? Increases for coronary heart disease, even hospitalizations. And how about this? I didn't look at specific data, but it is associated with increased arousals at night. I don't know if anyone knows Dr. Andrew Huberman. He's got a really popular podcast. I didn't look up this article, but I just plugged it in here. He says light between 11 p.m. and 4 a.m. stimulates the habenula, which is a part of your brain, produces feelings of disappointment that can lead to depression when awake. I'm like, is it the light or is it what are you looking at, right? You're scrolling through social media, see your friends on vacation, no. But yeah, light, if you think about the way our bodies evolved, right, from hunter-gatherer to the technological boom, we weren't really designed to have so much light hitting our eyeballs at night. Yeah, questions, Dr. Yu? Who wants to go first? Oh, you're just stretching? Oh, okay, yeah.
Going back to the chronotypes, I
Oh, yeah.
think Matt Walker talked about that, and I remember he said that it was under genetic control. Is your recommendation that if they are night owls, that they should adapt and change their chronotype?
No, my recommendation is if it ain't broke, don't fix it. So if you're in college and you can take the 10 p.m. class, 2 p.m. class, 6 to 9 p.m. labs, it's okay. And then you start your job and they're like, okay, you got to be here at 8. Then you got to fix it, unless you get a new job, right? So, yeah. There is evidence, though, that delayed sleep phase syndromes have more risk for cardiovascular problems, though. Right? It is probably because you don't sleep as much.
Doesn't that also affect growth in teens if you sleep too late?
Oh, does it affect growth in teens if you sleep too late? That's a good question. It's complex because what happens when we're young, we need a lot of sleep, especially deep sleep, because that's when growth hormone goes up. Mm-hmm. So if you don't sleep enough, then you can have lower rates of growth hormone. But does that affect your circadian rhythm if you're getting enough sleep and it's later? I don't know that answer, right? Yeah, I think, the question, Dr. Yu, that I always like to ask patients is, how much sleep do you need, right? At what number do you feel good? Is it 7? Is it 7.5? Is it 8? Is it 9? And then match that to your circadian rhythm. If it takes you an hour to fall asleep and you're trying to go to bed at 9, don't go to bed at 9, go to bed at 10. You want to be able to fall asleep within 10, 15 minutes, right? But some people really have in their mind, okay, I have to sleep at this time because I have to wake up at this time and then I got to go to work. But if you shift your bedtime and you really just match your circadian rhythm to your sleep duration, it makes it so much easier because then you're not fighting with yourself at night. Yeah. Good questions. Okay, let's keep moving on to movement. Oh, I didn't mean that, but it just happened. So movement, there's so many different types of movements. Okay, so walking, yoga, weightlifting, tongue exercises, and then even singing, right? Yeah. Oh, do you have a question? Oh, okay. Alrighty. So the impact of pedometer-based walking on menopausal women's sleep, a randomized controlled trial. This was done in Iran. It was a great study. So 112 postmenopausal women, average age was 55, were given the simple intervention of a pedometer, right? And they were just asked to walk comfortably. They didn't tell them, okay, you have to walk, 10 miles. They just said, okay, each week, increase your walk by 500 steps, which is about 0.22 miles. to the max step of 5 miles a day at the end of 12 weeks. So start where you are and then just, quarter of a mile by week, week by week, week by week. And at the end of 12 weeks, compared to those who didn't walk, the intervention group fell asleep faster, slept longer, had less sleep disturbances, and even this, use less sleeping medications, right? Because as we get older, what happens if we're on medications for too long? We wake up, we have to go to the bathroom, we're disoriented, we fall and break our hip. And a hip fracture in an elderly person is almost a death sentence. Yeah. Cool, walking. Okay, so effects of exercise on patients with obstructive sleep apnea, a systemic review and meta-analysis, right? So I love looking at meta-analyses because basically they review the studies for me. And this one looked at 9 randomized controlled trials in mild to moderate sleep apnea patients. And so they looked at people who were doing aerobic exercises, which they said was treadmill, elliptical cycling for 20 to 60 minutes, and even resistance exercise training. Guess what? It actually does reduce the AHI by 6, which, it's okay. I'll take it. I'm a big CPAP proponent, so I'm like, well, CPAP's still best. Even without changing the BMI, I think that's like something that's really important to know. Typically, when I talk to patients, one of the best ways to cure your sleep apnea is surgery or weight loss. But exercise, generalized exercise without losing weight can result in better sleep quality and even less daytime sleepiness. And so they divided the groups. Aerobic exercise plus resistance exercise was better than aerobic exercise alone, right? And they didn't even have to be, head and neck exercises. Some of them were just leg presses. Yeah. So overall exercising, guess what, is good for your health, good for your sleep. Myofunctional therapy. All right, so I'm new to the whole myofunctional therapy world. So learning about this is really interesting to me. It's been around for quite some time, 1918, and increased mandibular growth, improved nasal breathing, right? I think you guys all know about this, so let's just skip to the good stuff. 1999, it was started for management of sleep apnea, and then all different kinds of exercises, right? Tongue and facial muscles, strengthen the tone, orofacial muscles, improve alignment of the correct intraoral position. Yeah, they definitely didn't talk about this in sleep fellowship. This was a randomized controlled trial in adults, right? So mean age of 55 for 6 weeks doing the, I didn't look up the protocol, but there was a 6-week protocol that was basically focusing on the tongue. And no change in AHI, but an improvement in daytime sleepiness. So that's cool too. I mean, as long as there's a benefit. I think that's what integrative sleep medicine is about. As long as there's a benefit, less tired is great. And then this is a really good article by Camacho. He's actually an ENT in Hawaii. Yeah, so effect of myofunctional therapy on children with OSA. So I think it's probably more beneficial in kids, honestly, than adults. So review of 10 studies, 241, where there was a significant reduction by 43%. So it's very, very cool. Mean oxygen saturation increase, minimal though, and no change in oxygenation. Limitations though, there weren't a lot of randomized controlled trials or long-term data, but I'm sure as time goes on, we'll get more data about this. This was a neat one because it was respiratory muscle therapy. So not just myofunctional therapy, even actually exercising the lower respiratory muscles as well. A lot of people, 394 adults and kids, mild to severe. So not 8 out of 9 studies, that's really good. Showed an AHI improvement of 39 versus the baseline. Yeah. For adults, therapy, the respiratory exercise therapy resulted in a lower AHI by 7.6, which, I mean, if you have mild sleep apnea and you don't want to use a machine and you exercise your muscles, I think that, it could cure it. And snoring also got better and sleepiness improved. So that's respiratory muscle therapy. There were limitations, high risk of bias. I think the people who were reviewing the study actually did the study, so that's something to question. And then some of the evidence, I think, was a little bit shaky, but for what it's worth. I like this one. I don't know. I played a musical instrument. I don't know if anyone here played a musical instrument. I played the saxophone. And so this study looked at the effect of playing wind instruments or singing on sleep apnea, another meta-analysis. So anybody sing? Anyone in a band? That's okay. Well, okay, so A, I think that looks a trumpet, looks like a clarinet, flute, and a bassoon. Anybody know what this is here? Didgeridoo, yeah. So what does that have to do with it and singing? So didgeridoo and singing are the most promising interventions to reduce OSA and snoring, right? You gotta blow pretty hard through that big hole to get, right, and building up the muscles in your upper airway. Some of the studies actually that I've reviewed, there was one from Switzerland, actually, moderate sleep apnea went from moderate to mild just by the didgeridoo. It's very cool. So what's the best type of movement?
Singing.
The one that you do. I have a low threshold. I'm like, any movement is good. Let's just get you out of the chair. Okay, moving on to nutrition. Okay, which evening snack leads to better sleep? I think we are told milk and cookies, or the type of breakfast Dr. An gives us all here. You guys already know. So kiwis, you know how good kiwis are for you? Eat them at night. This is a study in Taiwan, effect of kiwi fruit consumption on sleep quality in adults with sleep problems. 2 kiwis an hour before bedtime for 1 month resulted in falling asleep faster, longer time spent asleep, and better quality sleep, right? Cool, huh? Yeah. And these slides I can email out, like you don't have to take them all, nothing proprietary here. Again, sleep and nutrition, diets high in fiber, right? So the American College of Lifestyle Medicine is a big proponent of the plant-based diet. More deep sleep, right? Deep sleep, lymphatic system, less light sleep. Diets with less fiber, right? More saturated fat, the milk and cookies, more awakenings at night, less deep sleep. Restless legs is associated with low iron. If your ferritin level is less than 50, increase it. Narcolepsy, not a lot of studies, but ketogenic diet, less carbohydrates. Studies in 9 patients for narcolepsy for 8 weeks. They had some modest improvement, so it may help, right? Eating a lot of sugar, a lot of carbohydrates can cause insulin spikes that can make you sleepy. But narcolepsy, it's such a hard condition to treat. Righty. Stress reduction. Yeah.
Have you come across any like vitamin D in sleep studies before?
Yeah, insomnia. Vitamin D deficiencies, usually insomnia, and then energy. Yeah. Yeah, I don't know about sleep apnea. I haven't looked it up, but I typically shoot for a vitamin D of at least 50. There's a wide range of what the lab says is normal, but typically people feel better above 50. Yeah. And it's interesting, even though I've always practiced in Hawaii and California, there's some people who are like undetectable vitamin D. So yeah, if you think that, they may not, yeah, just test. It's easy test. So stress reduction, mind, body, and soul. And so I practice holistically because something could be going in the mind, right? You're worried about something, you're anxious. Could be an issue in your body, right? Untreated sleep apnea. The food that you're feeding yourself, right? And then your soul. Are you lonely? Do you have purpose and meaning and fulfillment in your life? That's a big one that's not often talked about with sleep. So case study, it's a really long one. She's a 32-year-old female with anxiety and depression. She's had difficulty sleeping since her daughter was born 5 years ago. Breastfeeding was hard. Her daughter was a bad sleeper and needed to be held to sleep. And then, her sleep got a little bit better through the pandemic because she doesn't have to commute so far. She already takes Prozac for depression, anxiety, which is pretty stable, so she's okay there. She sees her therapist. She's been, tried trazodone, lorazepam, zolpidem, right? These are medications for sleep, hypnotic agents, at varying periods over the past 5 years. Sometimes they work, sometimes they don't. Her previous doctor's retired, and now her new doctor is like, no more sleeping pills. And I see this often. The new doctors will say no sleeping pills, but don't give them anything to do aside the handout for sleep hygiene. And if you're a person who has insomnia, sleep hygiene ain't gonna do anything because you already know those things, right? So typically the people who come to me are drug resistant, but really that just means that, we got to take a look at their thoughts in and around sleep. Yeah. She doesn't want to be on sleeping pills actually anymore because, the whole thing about the memory issues. And she didn't know what she could do to get more sleep. So the best recommended treatment that's been validated for chronic insomnia is cognitive behavioral therapy, or CBTI. And so what chronic insomnia is, it's learned thoughts, behaviors that can be unlearned. I like to think of it as you have the sleep software that you're born with, and then life happened. I call those life events malware, right? You got a new job, you went to college, you moved cities, you had a baby, malware attacks your sleep software. Now it just doesn't run as well. There's a couple bugs in there. And so CBT is that antiviral software, right? Insomnia can be only treated by addressing all the underlying causes. And we take a look at those stressful thoughts about sleep. A lot of people lose confidence in their ability to go to sleep. Sometimes there are negative sleep behaviors, right? Being on their phone, watching Netflix. A lot of people have a hard time learning how to relax or forgot how to relax. And then lifestyle practices that can affect sleep, like the ones we just talked about, right? Go for a walk, do some leg presses, eat a kiwi. And so as compared to sleeping pills, CBT works a lot better. The thing about it is you have to be willing to do it. It's a therapy, it's a behavioral change. A lot of people want the quick fix from the pill, but we do see lasting improvements, and it's the preferred treatment. So it's broken down into these 5 things: stimulus control, sleep restriction, cognitive therapy, sleep hygiene, and relaxation techniques. So stimulus control basically means use the bed for sleep and intercourse, right? Don't do any wake type of activities in bed. When you go to a restaurant, what do? You eat. When you go to your kitchen, right, you eat. When you go to the gym, you exercise. When you go to your bedroom, what do? You're on your phone, you're working, you're on Netflix, right? You're doing all these other things. It's no wonder, like, oh, why can't I sleep? Your brain's a little bit confused. Sleep restriction, that's about, it's also along the same lines of using your bed just for sleep, but it's really making sure that, okay, if I'm gonna allow myself to have 7 hours, I'm gonna give myself 7 hours to be in bed. Because a lot of people have insomnia, they probably sleep 5 hours, but they're in bed for 8 because they think, okay, if I'm just here longer, if I just keep waiting, then I'll eventually fall asleep. But it's the same sort of analogy, right? You have to think about your sleep associations. When your brain sees your bed, you want to be asleep. So it's really difficult for people who have insomnia to get out of bed, but that's actually the best thing that you need to do. Cognitive therapy, this is a lot of the work that I do. I take a look at those negative sleep thoughts. I'm a bad sleeper. It runs in my family. My mom's a bad sleeper. My aunt's a bad sleeper. It's just in my genes. Yes, there is a genetic component to insomnia, but guess what? You can change the way you think, and that changes the way that you feel, and that changes the way that you behave. Sleep hygiene, definitely really important. And then relaxation techniques. I love doing these with patients as well. So breathing exercises, visual imagery. I do clinical hypnotherapy, teach them about mindfulness. Right, mindfulness-based therapy for insomnia. This is a randomized controlled trial in about 127 people. 2 hours of learning about mindfulness meditation for 8 weeks, reduced insomnia, improved sleep quality, and people actually woke up less at night. What sleep? Sleep's when our brainwaves slow down. If we can slow down ourselves through, training our brain, guess what? Yeah, you're in such a better place than needing to take medications. So 7 principles of mindfulness is from Dr. John Kabat-Zinn. He is one of the big mindfulness teachers in the US, mindfulness-based stress reduction, beginner's mind, non-striving, letting go, non-judging, acceptance, trust, and patience. I think for a lot of us, non-judging is really difficult, especially people who have difficulty sleeping. What's wrong with me? My brain must be broken. I can't sleep. And we have negative self-talk. And when you have negative self-talk, guess what? You're in fight or flight. And when you're in fight or flight, guess what? Your brainwaves aren't slowing down. You're not setting yourself up to sleep. What can you do?
Doc, what's
Oh,
meant by beginner's mind?
Oh, beginner's mind. Do you have kids? You have a kid?
He's grown. but
He's
yes,
grown?
Yeah, I have.
So you remember when your son was little and you were reading a book about an elephant, and then you go to the zoo and you see the elephant, and it's like, wow, right? It's like, how do we have that same wonder? And how do we relate that to sleep? Well, if someone who has difficulty sleeping for 20 years, tonight it's going to be crap. Sorry. It's going to be horrible because for the past 20 years, I haven't been able to sleep. But if you take that principle of beginner's mind, okay, this is an opportunity. Maybe it won't be so bad, right? Can we look at it from a new and fresh perspective? Yeah, that's beginner's mind.
This is maybe a silly question, but can anxiety or the way we think affect our fragmentation, fragmented sleep? And do those also relate to RDIs, or is it only airway structural things that can contribute to RDI?
That's a good question. So let me repeat it. Anxiety can that relate to fragmented sleep and also RDI, which is a respiratory disturbance index? So typically people who have chronic insomnia have a hyper-aroused state, right? A lot of anxious people, right? Your brain is constantly going and going. In terms of RDI, right? RDI is respiratory disturbance index. That happens when your muscles relax and then your brain wakes you up to keep you from sleeping. That's a good question. I don't know if there's studies to show that, because I would think like if you're already asleep, then maybe your arousal index isn't bad. But if you have like a more narrow range, yeah, I'd say potentially. But that's a good question. I don't know. I don't think we've ever studied that. And I think as I'm thinking this out loud, that could be true based on what we know about women. And I always thought of it because, no offense to the men in the room, I always think women are smarter because women have a type of sleep apnea where they have a higher level of RDI. And that's based on, I always describe it as our brains are more sensitive. So if our airway is going to partially collapse, it's going to wake us up as a protective mechanism, right? But if you're anxious, is that also sort of a protective mechanism where your threshold to stay asleep is lower? Potentially. Yeah, potentially. Good question. I like it. Makes me think. Okay, so what do we do if we can't sleep? Or how do we be mindful, right? Knit. You do something low light in the middle of the night. Write, journal. That's a big one. Draw. Whatever makes you feel calm. So let's go back to MT. She's our working mother. She did her cognitive behavioral therapy in a book. You don't have to do one-on-one therapy. I've had a lot of patients who've just read a book about cognitive behavioral therapy and been able to improve their symptoms. We also talked about mindfulness and how that can help with insomnia, working through all those 7 principles. And guess what? She puts less pressure on herself to sleep. I think that's the biggest. When you learn about mindfulness, you learn about all of the things that you're doing. It gives you awareness. And when you're more aware, then you're able to make better decisions for your health in your life. And now she's more present with her family and she feels less stressed overall. So train your brain, right? I'm sure you all have seen anxious people in your dental chair. What can you do or what do you do? I took the American Society of Clinical Hypnosis course, and there's a lot of dentists that go there and run the program. And it's pretty fascinating because within like 20 seconds of a hypnotherapy exercise, they're more relaxed. But this isn't about that. This is about countdown to make anxiety blast off. 5, 4, 3, 2, 1. Getting out of your mind and into your senses. So train your brain, right? 5 things you can see. 4 things that you can physically feel. 3 things that you can hear. 2 things that you can smell. 1 thing that you can taste. It's hard to think about all the worries in the world and in your life when you're really focused on, okay, what are the 5 things that I can see in this moment? What are the 4 things that I can physically feel? And I do these exercises with patients, and it takes like 2 minutes, maybe less. It works. You're training your brain. Okay, another audience participation. Name these 3 sleep-promoting plants. The purple one over here. Lavender. How about this one? It's coming up to Thanksgiving. Yep, rosemary, someone said. And how about this one? Chamomile. Yeah, you guys are so good. Alrighty, so aromatherapy. What is aromatherapy? It's using the plants to stimulate our olfactory system to help us relax. So meta-analysis of 34 studies about aromatherapy and insomnia. What did it say? It induces the release of endorphins, which helps with sleep, helps with pain, helps with anxiety, depression, and chronic stress. And data from a wide range of groups, right? You think people who have chronic musculoskeletal pain, can they feel better with sniffing something? Yeah. People on hemodialysis, shift workers, university students, cardiac patients, people with sleep disorders. What I really like about lifestyle medicine is that there are a lot of less side effects, right? The risk is lower. Magnesium, L-theanine, lemon balm, house passion flower, lavender. Typically they work on GABA, right? The GABAergic system helps you sleep, slows down the brain waves. Avoid risky substances. I think we all know smoking is not good. One study showed that former smokers had elevated sleep disturbances, not as bad for current smokers. And I think that's because people smoke if they have anxiety. And so maybe, smoking, they don't have as much sleep issues. But it may be associated with sleep apnea, right? When you smoke, it can affect your upper airway in the sense where you can have more inflamed tissues. Alcohol. What can I say? It can keep you from having good sleep architecture. It actually decreases REM. And it's dose dependent. I mean, if you drink a lot of alcohol, sometimes it can help you fall asleep, but when the alcohol wears down, also the sugar in it too can be really disruptive to the quality of sleep. And so this is a study in China. Anytime you see a study with like thousands of people, it's typically done in China. They just have a lot of people. I learned that from my professors. So it's very well powered. It's associated with poor sleep and also snoring, right? Alcohol makes your muscles relax, increased risk for snoring and sleep apnea. Caffeine, most popular stimulant, most popular drug, blocks adenosine. And the problem with it can last a long time, right? 4 to 6 hours, half of it is out of your system. But, right, I mean, it could last, 9 hours, even longer, depending on how often you dose yourself with caffeine. And, right, coffee, teas, energy drinks, sodas. Energy drinks have a lot. I know some students who take 2 to 3 energy drinks, which is, wow. Alrighty.
Are there
Coming
any
to the
studies
end.
on like yerba mate and guanos, whatever, these natural energy substances and
Yeah.
whether they affect sleep in any way?
I'm sure there are. I know Andrew Huberman talks a lot about yerba mate. Yeah, and typically, right, when you take a look at the different types of caffeine, you have to look at the elimination curve and then how much it spikes. So typically, I think the caffeine from coffee has a more high peak and then lower, you peak and then you crash, versus green tea is said to have more of a steady energy curve. Yeah, so I don't know exactly for yerba mate, but I'm sure they've studied it in South American countries. Yeah, good question. Oops, am I going forward? Okay, coming to the end are our tips. So my number one tip is always make sleep a priority. All the benefits that it has for you. Rule out any underlying sleep disorders. Keep a consistent sleep schedule even on the weekends. Give yourself the opportunity to sleep at least 7 hours, right? A lot of us have a wake-up time. Do we have a bedtime or a bedtime alarm? That's helpful. Don't go to bed unless you're sleepy, right? Don't use your bed as your recliner, as your couch. And if you don't fall asleep after 20 minutes, just get out of bed. Establish a relaxing bedtime routine. The last hour of the day, actually, I think should be for you. When you're on a plane and it's landing, right? Does the pilot just go, or when you're exercising, you usually, warm up your body, right? Stretch the muscles. When you go to a nice dinner, right, do you just start with the main course or do you have your appetizer, right? Can you ease into that? Allow your brain waves to slow down. Try not to check your emails and then go to sleep. Use your bed only for sleep and intercourse. Make your bed room quiet and relaxing. Temperature is also really important. Part of our circadian rhythm, our body temperature decreases. I definitely see more insomnia cases in the summertime. A lot of folks in Hawaii don't have AC. So yeah, our body temperature cools down. Limit exposure to bright light, we talked about that. Avoid eating heavy meals. If you're hungry at night, have a light snack. Something high protein, high fiber. Caffeine and alcohol. If you are gonna drink, not a nightcap, maybe more of a brunch mimosa thing or a, happy hour? Pauhana in Hawaii, as we say, pauhana after work. And then move your body in a way that is sustainable for the long haul. All the references. Yeah. Thank you for your time and attention. I know it's been a long day, a long weekend. Appreciate it.
Thank you, Dr.
Yeah, of
Pacho.
course.
That was
You can
very
contact me.
nice summary.
Yeah, thank you.
Any questions?